The NHS could claw back more than £500 million a year if it was better at charging foreign nationals for using the health service. That's the finding of a report which has been commissioned by the Health Secretary. Yes, Jeremy Hunt wants to get tough on so-called health tourists and toughen up the rules for foreigners who access the NHS. The study he commissioned says that the cost of migrants who are already in Britain but not eligible for free treatment is £388 million. The report also says foreigners who visit simply to use the health service cost anywhere between £70 million and £300 million a year. As part of its immigration bill, the government has already announced it plans to charge an annual levy of £200 for non-EU migrants and £150 for foreign students. It's hoped that will raise about £200 million each year. Well, joining me now is the Conservative MP Henry Smith, who introduced a private member's bill last year to highlight the issue of health tourism. The evidence, the sort of factual evidence that amount of money is being lost. As far as I understand it, it all sounds rather anecdotal, and that concrete figures, are actually very difficult to come by.
Well, that's exactly part of the problem. It's because we're not properly auditing and recording the treatment of foreign nationals on the NHS. The report suggests that only 16% of treatment of European nationals on the National Health Service is actually recovered. When I did Freedom of Information Act requests last year to all health trusts in the country, less than a quarter could actually provide any data at all. So the problem is properly recording it, and the estimates range from £200 million to £2 billion.
And if it is £200 million, it's not that big a problem, is it?
Well, if we were to recover 3/4 of the costs that we don't currently, that would be the equivalent of being able to employ an extra 4,000 doctors or an extra 8,500 nurses.
What do you say to they don't want to be the border agency? Because it would be frontline staff who would have to be involved in checking the eligibility of patients that come to them from abroad, where they're from, and how much they'd have to pay.
Well, I understand those concerns, but I would say two things to that. First of all, the rest of the world do this already. If you go to France or Spain or the United States or Australia and you seek public health care, they will record your eligibility for that. And secondly, if we recover the costs, actually this will be less of a burden on the NHS, not more.
They have that, Henry Smith.
Well, that's not how the system is envisaged to operate. We won't have receptionists at GP practices acting as border guards. Well, it will work in the way that it works in the rest of the European economic area, which is we have a reciprocal agreement. It's just that we're not properly recording the cost of treating foreign nationals on the NHS.
But you haven't answered how will the money come from patient A who comes into Claire Gerarda's surgery and says where they're from. You have to ask a whole list of questions. Presumably that will have to be done by somebody in a GP surgery. Is that right?
Well, if you go to open up a bank account as a foreign national, you have to provide nationality details. The rest of the private sector does this all the time.
The NHS
really
isn't the private sector. The problem is
it is an element, as Diane Abbott said, the Labour...
I do think the charge of xenophobia is really quite insulting. This is what the rest of the world does. If you are a Brit going abroad on business or on holiday to Europe or elsewhere in the world, you are expected to carry your European health insurance card or have travel medical insurance when you travel abroad. This is what we do. It's what the rest of the world does. It's time that the British taxpayer wasn't picking up this burden.